Welcome to an introduction to the HSE National Child Protection and Welfare Policy. This presentation will provide you with an overview of the policy and its suite of guides. It outlines your key responsibilities and informs you where to find detailed guidance when you need it. It is important that all staff must read and adhere to the policy and guides. The policy provides the framework for keeping children safe while availing of our services. Everyone working in the HSE has a role to play. Always consult the full policy or the relevant guide. The policy is supported by 4 guides that provide detailed, practical advice to implement it. You should always refer to the relevant guide when necessary. Child safeguarding and child protection is a shared responsibility. Safeguarding is about prevention and protection, while child protection is about responding when concerns arise. This policy is underpinned by Children First legislation and national guidance. These laws set out our legal responsibilities and inform everything that follows in the policy and guides. The policy's general principles are informed by Children First legislation and guidance, and the UN Convention on the Rights of the Child. Children have the right to be respected, protected, and listened to. At the same time, we balance the rights and responsibilities of parents and carers, always keeping the child's best interests at the center. Safeguarding is everyone's responsibility. The child's best interests must always come first. Prevention and early intervention are essential for better outcomes for children. Safeguarding is a multi-agency responsibility, and staff need to be clear about their own role and the roles of others. Our safeguarding responsibilities extend not only to children using services directly, but also to children in contact with adults using our services. We all have a duty to consider children's welfare and stay alert to signs of abuse, harm, or exploitation. Section 5 of the policy sets out the systems that support safeguarding across the HSE, including governance, training, safer recruitment, and interagency working. You don't need to memorize this list, it's here to show the breadth of safeguarding activity. We all have responsibilities under this policy. The key message is, know your role, know how to recognize concerns and report them, and always consult when necessary. You must also complete Children First training and follow your service's child safeguarding statement. You should refer to Section 6 of the policy for the detailed list of all your roles and responsibilities. Line managers must support staff by providing guidance, supervision, and oversight. They must help their staff respond appropriately to concerns and ensure records and training requirements are met. Service managers are responsible for systems, governance, and compliance. This includes local procedures, secure record keeping, and Children First compliance. Senior management must provide oversight and assurance, ensuring the policy and its guides are implemented and monitored. Mandated persons and designated officers have additional legal and policy responsibilities outlined in Section 6.5 and 6.6 of the policy. Mandated persons have 2 legal obligations under the Children First Act 2015, to report the harm of children at or above a defined threshold to TUSLA, known as mandated reporting. To assist TUSLA if requested, in assessing a concern which has been the subject of a mandated report, known as mandated assisting. Guide 2 will help you carry out these requirements. Section 7 of the policy gives an overview of the HSE Child Protection and Welfare Reporting Procedure. A child welfare concern is a problem experienced directly by a child, or by the family of a child, that is seen to impact negatively on the child's welfare or development. A child protection concern is when there are reasonable grounds for believing that a child may have been, is being, or is at risk of being, abused, harmed, or exploited. Reasonable grounds can include being told, seeing, or receiving information from others. It is not necessary for you to prove that abuse, harm, or exploitation has occurred to report your concerns. All that is required is that you have reasonable grounds for concern. It is TUSLA's role to assess concerns that are reported to them. You must be aware of signs of abuse, harm, and exploitation. Always consider the welfare and safety of all children, including those children in the lives of our adult service users. Harm is the assault, ill treatment or neglect of the child, in a manner that seriously affects, or is likely to seriously affect the child's health, development, or welfare. Or sexual abuse of the child, whether caused by a single act, omission, or circumstance, or a series or combination of acts, omissions, or circumstances, or otherwise. Child abuse can be categorized into 4 different types: neglect, emotional abuse, physical abuse, and sexual abuse. A child may be subjected to one or more forms of abuse at any given time. Child exploitation may sometimes be recognized as its own type of abuse, however, it usually falls within one of the 4 main types. The categories of abuse and exploitation are explained in detail in Guide 2, Recognizing and Reporting Child Protection and Welfare Concerns. What matters most is recognizing concerns and taking action. The HSE Child Protection and Welfare Reporting Procedure summarizes the steps to follow when responding to concerns. It must be followed in line with Section 7 of the policy and Guide 2, Recognizing and Reporting Child Protection and Welfare Concerns. Accurate and timely record keeping is essential for the protection and welfare of children. Service managers must ensure each service has a child protection and welfare record management process and a local written procedure. Staff are required to understand how to correctly maintain these records. Records must be managed in line with Section 8 of the policy and Guide 3, Managing Child Protection and Welfare Records. The HSE Child Protection and Welfare Record Management Checklist is available to support appropriate child protection and welfare record management within the HSE. The safety and welfare of the child is paramount. Information may be shared lawfully and proportionately to protect a child. While seeking consent is best practice, consent is not required where sharing is necessary to protect and safeguard a child. As soon as possible, you should explain to the service user that there are limits to confidentiality. See Section 9 of the policy and Guide 4, Sharing Child Protection and Welfare Information, for detailed guidance. The HSE Child Protection and Welfare Information Sharing Framework focuses on 5 key questions that will help you decide if there is a basis for sharing information in situations that apply to child protection and welfare. Find the HSE National Child Protection and Welfare Policy and its suite of guides at the HSE Children First National Office's website, www.hse.ie/childrenfirst, or scan the QR code on the screen.